Welcome back. This is part 2 of alterations in musculoskeletal function. We're going to pick up where we left off before here. We're talking about rheumatoid arthritis. So diagnostic studies for rheumatoid arthritis, a positive rheumatoid factor is going to occur in about 80% of our patients, maybe even an ANA. An ANA is an anti-nuclear antibody. So that's a titer that we can do. It's a blood test that's drawn, and it helps to tell us about whether or not there's antibodies to this rheumatic factor, this rheumatoid arthritis. Also, we can look for signs of active inflammation like a C-reactive protein and a ESR, that's a sedimentation rate. So that's our erythrocyte sedimentation rate. These are indications that the patient has inflammation going on in the body, and they're just general inflammatory markers. So it doesn't tell us that the patient has rheumatoid arthritis. They could also be elevated for other types of inflammation. However, they are elevated in rheumatoid arthritis. So that would be the situation that we're looking at here, is trying to validate that we do have active systemic inflammation that's happening in our patient. And these are just a couple pictures here of what the, over on the right hand side, the patient's hands, on the left hand side there, what the x-rays would look like of somebody who has rheumatoid arthritis. And you see the severe joint disease and the malalignment of the joints. Couple more questions. 54-year-old female was recently diagnosed with degenerative joint disease. This condition is characterized by a loss of If you answered B, you're correct. Degenerative joint disease is caused by a loss of the articular cartilage. Spondylizing or spondylitis, ankylosing spondylitis, is an inflammatory joint disease. This is a systemic disease. It's immune. And the primary site that it's going to attack is going to be this site where the ligaments and the tendons and all the joint capsule are attached to the bone. So this is the end part of the bone where it's attaching into the joint. So you can obviously, that's going to be a really severe joint kind of disorder that's occurring here. So there's inflammation of all of these different components, and this can lead to the patient having all sorts of injuries in the joint as far as the ligaments go and the tendons go and the bone itself. But we have inflammatory cells. They're starting to infiltrate and to erode the cartilage or in the joint itself and in those structures. With repair, we start to get the scar tissue starts to form in that area and starts to calcify, which then causes this kind of fused joint, which is not going to be very functional. So the joint is not going to be able to move like it normally should. Early symptoms may start with back pain in the early 20s, progresses over time, stiffness, and this is one of the areas you often see it, is you often see it in the back and in the spine, and we start to see the loss of our normal movement in the spine, and we might start to see some lordosis or some kyphosis that is occurring in the way that the patient is standing in the spine. So lordosis is the loss of that normal lumbar curvature. So normally, as the spine comes down, it kind of curves inward and then back outward at the lumbar area. And that curvature at the lumbar area gives it more strength. So anything that has a curve to it, like an arch to it, is going to have more strength. And that's why it has that in the lumbar area. Well, okay, we start to lose that, and the spine starts to become straight in the lumbar area. That's going to make the spine in that area weaker and more apt to have injury. In the upper spine, we start to see kyphosis. That's kind of the bending over part, so the hunchback kind of thing that we see. It's chronic progressive disorder of the joints, often referred to as rheumatoid. It affects both men and women, but the ankylosis thing is the fixture of the joint, the inflammation of the ligaments and the tendons. So we're going to see a lot of inflammation in that joint area, and that can then lead to a lot of disability in the patient. The complications incur. One of the main things you're going to see with patients is going to be a lot of backache, stiffness, some tenderness over the spine, some immobility, decreased range of motion. So the patient's not going to be able to move the way they normally would be able to move. The kyphosis could actually cause the patient to have respiratory difficulties. Now, because this is an inflammatory condition over a long period of time, the patient may also develop blindness, and we can have visual disturbances. Diagnostically, we can look at a low H and H. So the H and H may decrease. The ESR, that's the erythrocyte sedimentation rate, may start to increase. We can see an elevation in our ALK phos, and that's it's an enzyme, a chemical in the blood that starts to build up. X-rays may reveal some changes that are occurring in our joints as a result. This is showing some of the straightening of the back that occurs when we start to lose that lumbar curvature down at the bottom there. The spine should curve in at the lumbar area and then kind of curve back out in the sacral area, and it's not doing that here. We have a very straight spine in this patient. So we have an 80-year-old male presents with skeletal pain and tenderness, especially in the hips. He's diagnosed with osteomyelitis caused by If you answered letter D, you're correct. Osteomyelitis is a metabolic disease characterized by inadequate and delayed mineralization of the bone. Another joint problem is gout. Gout is an inflammatory and metabolic disorder where we have an abnormal uric acid production or I should say excretion. So we may have too much being produced and too little being excreted, or we may just have one or the other of those situations occurring. So uric acid starts to build up in the body. High levels in the blood and body fluid starts to crystallize. So this high level of uric acid in the body will start to crystallize. One of the places it can crystallize and that crystal will deposit is in the joints. One of the most common joints for that to occur in is going to be in the big toe. Here you see the swelling and the inflammation that is caused by having those crystals forming in the synovial fluid in that big toe. Okay, this is also called gouty arthritis. So uric acid, though, is also eliminated by the kidneys. So uric acid goes down and gets eliminated by the kidneys. And uric acid can form these crystals into stones in the kidney itself, too, which can cause the patient to develop kidney stones that are formed out of uric acid and cause renal damage. Now, we're going to talk about renal a little bit later on in the semester, and then you'll understand that most kidney stones are not uric acid in nature, but uric acid does get eliminated through the kidneys, and uric acid in gout could build up and cause these crystallizations to occur in the kidney, causing a stone and then causing a blockage of the urinary tract and renal damage. So symptoms, the joints may appear dusky, they may start to become very tender, and that's usually one of the first symptoms we see is tenderness in the joint, maybe some redness or swelling in the joint, and maybe some low-grade fever that may be possible. The severity is really variable. Some people are asymptomatic, some people just have minor symptoms they can handle. Other people get real severe symptoms of gout. Diagnostically, we're going to look at the patient's uric acid level, because uric acid is the thing that is causing the problem. And this is a picture here just showing how that uric acid is starting to build up in the synovial fluid, which is causing the inflammation inside the joint and the redness and swelling that we get around the joint. Treatment-wise, of course, we want to decrease the amount of inflammation and pain the patient has, and we can do that by giving the patient either non-steroidal anti-inflammatories or corticosteroids. Non-steroidal anti-inflammatories, NSAIDs, are your medications like Advil, ibuprofen, etc., and they're going to decrease the amount of inflammation at the site and help to decrease pain. Allopurinol is going to be a medication that actually decreases the uric acid level. So this is the medication that's actually going to decrease the uric acid, which then will decrease the problem. The other drugs we're giving here. The corticosteroids, the NSAIDs, those are just decreasing the amount of swelling and pain. They don't stop the problem. They don't treat the problem. So we need the allopurinol in order to be able to do that. Adequate hydration is important so that we're running that uric acid through the kidneys and hopefully not developing any crystallizations in the kidneys. We can restrict foods that are high in purine because it helps to, the purine is going to cause the uric acid to crystallize. It's going to be one of the components in the crystallization process. It's also said bed rest and immobilize the joint. That may not be necessary in most patients. A 34-year-old female was recently diagnosed with rheumatoid arthritis. A physical exam revealed that the inflammation started in the well, if you said the synovial membrane, you are correct. Inflammation of rheumatoid arthritis starts in the synovial membrane. We can get some problems in our skeletal muscle in addition to the bone problems that we've talked about so far. One of those is called a contracture, and that's what the picture here is illustrating. And in this case, what happens is the muscle shortens. Now, there's a couple reasons why this could occur. Maybe your patient has had some kind of neurologic injury where they're no longer using the joint, so they're not actively getting up and standing and walking. So somebody who's maybe in a wheelchair. If they're in a wheelchair for a long period of time, what will happen is that the muscle starts to become shorter and shorter and shorter because we're not stretching it and making it longer. To some extent, we have some of this that happens all the time with us. If we're not exercising and we're not stretching, our muscles become shorter than they need to be, and that can lead to injuries. So that's why they always tell you to stretch before exercising, is because it lengthens the muscle, so the muscle is more flexible and you get the full range of motion. However, when we have certain situations like a central nervous system injury, so that's CNS injury is central nervous system injury, that can cause a failure of the calcium pump, even when we have ATP available. And then that can cause a contracture to occur in the patient where the muscle just shortens and then we don't have full motion of that joint. The other thing it says here is it talks about stress-induced muscle tension causing contracture over a long period of time. So neck stiffness and chronic anxiety. People who are chronically anxious tend to hold some of that anxiety in their neck muscles and their shoulder muscles. And then over time, the neck and shoulder actually kind of starts riding up as they have that constant tension in there. Whenever you think about it, just remind yourself to drop your shoulders down or relax your shoulders because we tend to hold a lot of stress in our neck and our shoulder area. Disuse atrophy can occur. So somebody who is not using the muscles, so somebody maybe who is paralyzed and in a wheelchair who's not using the muscles, can end up with disuse atrophy. So the muscle size becomes smaller. When it mentions here a 3% daily loss in muscle size as a result of bed rest. So just having a patient on bed rest or just resting, and maybe you broke your arm or something like that and had to have a cast put on, and you take the cast off and you look at your arms and you're like, oh my gosh, my one arm is so much smaller than the other one. That's a disuse atrophy. So the muscle atrophied. It became smaller because we're not using it. Fibromyalgia is another thing that can happen with our patients, another disorder. It's chronic. It's a non-degenerative, non-progressive, and non-inflammatory kind of disorder, but it causes a lot of pain, and that pain can make it very difficult for people to be able to carry out their activities of daily living. So they end up with chronic, widespread, and joint and muscle pain. The symptoms oftentimes are very vague, and this is one of the things that's very frustrating. And for years, we didn't really know what this was. People would come in complaining of back pain and back pain and back pain. And it's okay, well, there's nothing wrong on your x-rays, etc., but, they can continue to complain of back pain. Well, for a lot of years, we just assumed that these people were probably drug seeking or something like that, and it was kind of blown off as being not a problem. And we found out, well, there is an actual condition that is occurring in the patient. This could be caused by, or I should say is associated with. So sometimes fibromyalgia will also be kind of happening concurrently with something like a viral illness or a chronic fatigue syndrome, or one of these other conditions here. They kind of happen at the same time. So we may have a cause, or we may just have something that is maybe the patient's predisposed to viral illness because they have fibromyalgia. We don't really know. We just know that those things are associated. Happens more frequently in women ages 20 to 50. They get fatigue, they get an increased sensitivity to touch in the absence of inflammation. Okay, so the inflammation isn't there, but we're continuing to get that pain and that sensitivity to touch. Number of places where we're going to check for pain in the patient. The patient has to have tenderness in 11 of these 18 points in order to be able to say that the patient has fibromyalgia. Another condition that we need to know about are bone tumors, and bone tumors are actual cancer that's occurring on the bone or in the bone itself. So this is a tumor that's occurring on or in the bone. Okay, so again, this is going to cause a lot of pain. This could cause pathologic fractures, so a lot of things associated with bone tumors. We may not know a lot that the patient has a bone tumor until the patient starts having pretty significant problems like maybe a pathologic fracture. Oftentimes it occurs in the metaphysis, which is the area at the ends of the bone where the bone is growing. Let's take a look at some questions here as we start rounding out our content from our altered musculoskeletal area. So, a 46-year-old male presents with severe pain, redness, and tenderness in his big toe. He was diagnosed with gouty arthritis. The symptoms he experienced are caused by the crystallization of blank within the synovial fluid. Gout is caused by an increase in uric acid. So the answer is C. If you answered answer C, then you are correct. Okay, let's take a look at another one. A 46-year-old male, lots of 46-year-olds in this scenario, huh? Presents with severe pain, redness, and tenderness in the right big toe. He's same guy, but he's at risk for developing what? If you said renal stones, you were correct. Renal stones are 1,000 times more prevalent in individuals with gout, with primary gout, than in the general population. Now, again, don't misunderstand that. It's 1,000 times more prevalent in somebody who has gout that they're going to have a uric acid stone than in the general population. However, most renal stones are caused by calcium. We're going to talk about that in the renal section, though, so don't get too involved with that now. Fibromyalgia is a chronic musculoskeletal disorder characterized by what? Fibromyalgia is characterized by diffuse pain, fatigue, and point tenderness. Please also make sure that you are reading the section in the book, the chapter in the book on this section too, so you can have a fuller understanding of our alterations of musculoskeletal function. Thanks for joining me this time, and until next time, bye now.